My name is Anushka Das, and I am a sophomore at Harker High School.
I'm Leela Amladi, and I'm a sophomore at St. Francis High School.
My name is Michaela Vachev, and I'm a sophomore at Harker High School.
This video is intended for preteens and teens who are actively involved in sports and/or dance and are somewhat familiar with injuries. We will be discussing some common lower body sports injuries and presenting some exercises and stretches that can help reduce or prevent them. The most common sports injuries are strains and sprains. A strain is an injury to either a muscle or a tendon, a fibrous tissue that connects muscle to bone. Depending on the severity of an injury, a strain may be a simple overstretch of a muscle or tendon or a partial to complete tear. The most common lower body strains are in the calf, hamstring, and back muscles. A sprain is a stretch or tear of a ligament, a band of fibrous tissue that connects two bones across a joint. The most common lower body sprains are ankle and knee sprains.
Lower back strains are muscle strains in which the muscles are overworked or pulled. The spinal column is supported by numerous muscles that support the spinal column as well as the entire upper body. These muscles, bones, and ligaments work together to provide strength and control for daily activities as well as your athletic activities, which is why they're so injury prone. When doing lower back exercises, you focus on strengthening the core, especially the multifidus muscle, which is behind the spine and supports it, and the transverse abdominis muscle, which is your deepest set of abs. So when you are trying to do your back exercises, make sure you tighten your abs so they get the biggest workout. Position yourself on the ground on your hands and knees with your arms shoulder width apart. Tighten your ab muscles, lift your left arm and right leg up. Hold and rest. Switch legs and arms. Keep your core muscles tight as you change sides. Do each arm and leg pair 10 times. Start out laying down on your stomach. Then get up on your forearms and your toes, making sure that your body is in a straight line. Hold for 15 to 20 seconds, rest, and repeat. While lying on your back, lift your arms and legs up so that you look like a bug on its back. Then straighten out your right leg in front of you while moving your left arm so that it lies straight next to your left ear, a few inches above the ground. Return them to their original positions. Do the same thing with your left leg and right arm. Make sure that your arms and legs don't touch the ground and that your abs are tightened. This exercise is called the dead bug. Do each arm and leg pair 10 times, so total 20 times. Get on your side. Hold yourself up with your forearm and the sides of your feet. Then once you're balanced, lift your other arm straight up. Keep your body in line and your abs tight. Hold for 15 to 20 seconds, rest, and repeat. Accommodate yourself according to your needs. If your back starts hurting, you're probably pushing yourself too far. So do the exercise for a smaller amount of time and focus more on strengthening your core muscles.
Most knee pain results from ligament injuries in the four stabilizing ligaments of the knee: the anterior cruciate ligament, the posterior cruciate ligament, the medial collateral ligament, and the lateral collateral ligament. The most common of these injuries is the anterior cruciate ligament injury, or the ACL sprain. An ACL sprain takes place when a pivoting force is applied to the knee while the foot is planted or being planted. It can also occur when a blow is directed at the knee. These injuries are much more common in females than males and occur in sports like football, basketball, volleyball, and dance. To avoid knee injuries, it is important to strengthen your upper leg and hip muscles, especially your quadriceps and gluteals, so that they can support your knees in their daily activities. So the exercises for your knees are actually working your quads and hips, so that your knees don't take the load of your work. Sit down like you're about to get in a chair. Make sure not to bend your upper body as much as your legs, so that your quads and thighs get a good workout. Also, keep your toes, knees, and hips as aligned as you can to ensure that you're exercising correctly. Your quads should be fatigued, but your knees should not be sore. Repeat 15 to 20 times. To do a wall squat, flatten your back against the wall and bend your knees as if you are sitting in a chair. The point of this exercise is to shift your weight posteriorly so that you do not put too much pressure on the front of your knees, but can still strengthen your quads. So if your knees start to hurt, you may have gone down too far. Ease up and hold until the muscles above your knees, your quad muscles, feel fatigued, which is about 15 to 30 seconds, and then stop and rest. Repeat 4 more times. To do a single-legged squat, lift one leg off the ground and balance on the other. Then slowly bend your ankle, knee, and hip, keeping your pelvis level. Do not allow your knee to come in front of your toes or turn inward so that it's on the inside of your big toe. Perform 15 to 20 reps, then switch to the other leg. Repeat 2 to 3 sets on each leg until your upper leg muscles feel fatigued.
Ankle sprains are very common. Most ankle sprains occur when your foot comes down awkwardly while playing sports such as soccer, basketball, volleyball, or football. Usually your ankle rolls to the side and the foot turns inwards, causing the lateral ligaments to tear. You can also injure your ankle because of sudden impacts, uneven surfaces, or unsteady landings after jumping. To help prevent or minimize the effects of ankle sprains, we need to work on our balance and our calf and surrounding ankle muscles. Double leg calf raises. These involve lifting yourself on your tippy toes and then returning your weight to your entire foot slowly. This helps to strengthen your ankle muscles and work your balance. When doing single leg calf raises, stand on one leg, get yourself on your toes, ease down, and then switch legs. Do for a total of 20 times. This alternation changes your equilibrium and therefore helps your balance. Make sure that you keep your knee straight so that your ankle does all of the work. Now we'll show you an ankle exercise that involves inversion and eversion. Inversion is the motion involving turning your foot inward, towards your big toe. Eversion is the motion involving turning your foot outwards, towards your little toe. The exercise we will show you involves both. Sit on a chair that allows you to place your whole foot on the ground comfortably. Place a towel on the ground and place your foot on it. Using eversion, start with your foot turned inward, put pressure on the towel or grab the towel with your toes, and move the towel towards your little toe. Continue down the length of the towel. Then switch directions, starting with your foot turned outward. Grab the towel with your toes and move the towel in towards your big toe.
In addition to conditioning properly with the exercises we have showed you, here are some everyday tips from the Palo Alto Medical Foundation on making sure you are healthy and ready for vigorous activity. First, stay hydrated. Second, avoid overtraining and training improperly. Both situations lead to improper body mechanics, muscle fatigue, and ultimately injuries. Third, know and follow rules. If your coach tells you how to do a certain move or exercise, wear a certain clothing or footwear, or use a certain equipment, follow his or her instructions. And lastly, warm up and cool down properly before and after you exercise. Lift both arms straight up by your head and stretch up to the sky. Slowly bend down at the waist. Go as far as you can. Your hands do not have to touch the ground. After about 20 seconds, roll all the way up, vertebrae by vertebrae, very slowly. Pull your knee up to your body with your hands and at the same time rise on the toes of your other foot. Step down, move forward, and switch legs. Take about 10 steps on each leg one way and then 10 steps on each leg back. Lift one arm straight up by your head, hold one foot to the back of your thigh, and stretch up on your toes with the other foot. Move forward, switch arms and legs, and repeat. Again, take about 10 steps on each leg one way and 10 steps on each leg back. Kick your legs straight out in front of you and touch the toes with your opposite hand. At the same time, rise on the toes of your stance leg. Lastly, bend down at the waist and at the same time, hold one leg straight out behind you, arms straight out, like an airplane. Hold this for 5 seconds, then step forward with your opposite leg and repeat. Perform 10 times on each leg. Thank you so much for watching my video. Now I'd like to introduce Debbie Iwasaki, who will summarize the points we have presented and demonstrated in this video.
The dynamic stretches and exercises that you've seen today were intended to provide a baseline for flexibility and strength to the core and lower extremity. Although we know that accidents do happen, and if they occur and you sustain an injury that causes swelling to any one of the lower extremity joints or that causes difficulty walking for more than 48 hours, it's really important that you see your primary care physician to get further advice and further evaluation.